Contrary to the popular opinion, vaginal thrush, or as it's popularly called, vaginal yeast infection, is not caused by being sexually active. Studies have shown that 75% of women have experienced vaginal thrush at one point in their lifetime, or at least once in their lifetime. On today's video, I'm going to be sharing with you the causes of vaginal thrush, or vaginal yeast infection as it is called, the symptoms, and the treatment, especially home remedies to vaginal yeast infection, how you can treat it at home so that you will be fine. My name is Nurse Goretti. I'm a registered nurse and midwife, and also a public health nurse, and I am interested in women's health and lifestyle, so I create those kind of content. So if you're interested, hit the subscribe button. Here in Nigeria, vaginal yeast infection or vaginal thrush is very common among women. Once you go out, once you step out of your house, you will hear someone selling drug. Infection. That's what they'll be shouting. Whenever I see it personally, I'm always marveled at how people actually go and buy this stuff, especially people with vaginal yeast infection, whereas the treatment is very simple. Usually, vaginal thrush is caused by the overgrowth of a fungi called candida or yeast. So normally, candida is what you call the normal flora of the body, of the human body. It's found in your vagina. It's also found in some other areas of your body. It only becomes a problem when there is overgrowth, when there is overproduction of it, when it becomes too much down there. And the major reason why it happens is if there are changes in the pH of the vagina. You know, the vagina is usually acidic in nature. So if there is anything that happened that altered the pH of the vagina, it could lead to the overgrowth of this fungi in the vagina. And when it grows too much, it could lead to an abnormality. So let's talk about the symptoms of vaginal yeast infection. How do you even know that what you have is vaginal yeast infection? Because what most of us do is that we self-diagnose ourselves. So what are the symptoms that you see, and you will determine that yes, this is vaginal yeast infection. Number one is itching. Now, itching is one of the symptoms that a lot of diseases affecting the vagina usually comes with. When I talk about itching, I'm not talking about itching of the vagina. I'm talking about itching of the vulva. You have to know the difference between the vulva and the vagina. The vulva is the external part. That's the part that you see with your eyes, while the vagina is inside. This kind of itching is like the most horrible thing you can experience as a woman. Oh my god, it's usually very funny and at the same time very, very uncomfortable when you are experiencing it, especially if you are in public. You'll be so embarrassed. So what women do is that they will be rubbing the two legs together, trying to cause friction to itch that particular area. So this kind of itching is actually very horrible and very, very, very uncomfortable. If you have never experienced it, then thank your God. Itching of the vagina could also occur. Remember, I said that it's the vulva that itches, but itching of the vagina could also occur. You can't rule that out. But most of the time, what women experience is vulva itching. Before I go on with this video, I like to plead with you to hit the subscribe button so that you can see more of my content whenever, and you can engage. Also, please hit the like button and comment where you're watching from so that I can send you a hug in my next video. Next symptom is vaginal discharge. Vaginal discharge is one of the most common symptoms of vaginal yeast infection. In short, once you start having discharge that is not the regular discharge that you usually have, what usually comes to mind is vaginal yeast infection. The discharge that you see in vaginal thrush is usually creamy white and thick, and can have that appearance of cottage cheese. The next one is soreness of the vulva, especially. So the vulva becomes sore and painful, such that when you are even trying to urinate, it's usually painful. It usually leads to painful urination or even painful sex. If you're having any of the symptoms that I'll be mentioning, it's not vaginal thrush. You have something else, because a lot of times we mistake every symptom that comes from the vagina as vaginal thrush or vaginal yeast infection, or as it's popularly called in Nigeria, infection. Number one is a smelly or colored discharge. For vaginal yeast infection, the discharge that you have is not smelly. It's just thick and it's creamy white, but it's not smelly, and it's not colored. It doesn't have any other color such as green or pink. If you have any other vaginal discharge color, you have to suspect another illness and not vaginal infection. Check out my video on abnormal vaginal discharges. The second symptom that shows that you do not have vaginal yeast infection is if you bleed during or after sexual intercourse or in between periods. If you are bleeding, it's not vaginal thrush. Vaginal thrush doesn't come in that manner. The third one is if you have rashes or blisters around that area, it's not vaginal thrush. How do you know you have vaginal thrush? Normally, if you go to the hospital with these three symptoms that I've mentioned, which are itching, creamy or white vaginal discharge, and soreness, the first thing that comes to mind is vaginal thrush, and that is exactly how you know. So the test that you can easily carry out at home to know if you have vaginal thrush is a test that is usually used to determine the acidity of the vagina, the pH of the vagina. And you can get the test kit over the counter. This test actually works by color change. To carry out this test is that you swab the vagina with cotton wool and rub the secretion on the test strip and compare it with the colors on the test strip container. If it reads a pH of 4.5 or less, then it's likely vaginal thrush. Other tests that they could carry out is a swab test. That one you have to go to the hospital or to a lab. An important thing that you should note that people usually do not know is that you cannot use antibiotics in the treatment of vaginal yeast infection. Get that right, because antibiotics is used in the treatment of diseases caused by bacteria, and vaginal yeast infection is not caused by bacteria. So that is why a lot of times women go over the counter and buy antibiotics and take it for a long time and tell you that this their vaginal yeast infection is not curable, that they have had it for years. They have been taking this drug, they have been taking that drug, whereas they have not taken the correct drug that they should take. So I'm going to be telling you the correct medication that you should take for the treatment of your yeast infection. If your yeast infection is not as severe, you can initiate the treatment at home by using some topical thrush treatment. This topical thrush treatment comes in the form of pastries and creams. The creams are usually the most common ones. You must have heard of Clotrimazole. Clotrimazole, one of the most common antifungal cream used in the treatment of yeast infection. And all you need to do is to rub the cream around your vulva, not inside your vagina. Around within a space of 1 week, you are good to go. If the itchiness is very mild, you can use cream to treat it. Another one that you could use is pastries. These pastries come in form of tablets, and it comes with an applicator which you can use to insert it inside the vagina. It contains some anti-yeast drugs or medications. A single large dose is enough to cure your yeast infection, especially if it is mild. This topical treatment can be used by even pregnant women, unlike other medications that are used in the treatment of thrush. One key thing that you should also note when you are using topical antifungal cream is that it could cause the break of condom. Yes, so if you are using it, be sure to avoid sex, especially if you use condom as a method of protection or as a method of preventing pregnancy. The next one that you could take is tablets such as fluconazole. It's available over the counter, and you could take it as a single dose, 1 tablet each day, and by the time you're finishing the dosage, you are okay. But as a pregnant woman, do not take this drug. Also, if you are breastfeeding, also do not take this drug. It's not for you. Other things that you could do to help with the symptoms of vaginal thrush is to avoid wearing tight-fitting clothes. Yeah. First of all, when you wear tight-fitting clothes, you won't be able to do the itching dance. You won't be able to do that if you are wearing a tight-fitting clothes. It's only when you are wearing a loose clothing that you could easily flap your 2 laps together and get some soothing effect from that. Another thing that you should definitely avoid is use of fabric conditioner or harsh soap in washing your underwears. You do not need a harsh soap or all these antiseptic this, antiseptic that, biological powders to wash your underwears. All you need is a mild soap, because what happens is that these kind of agents that you use in washing your underwear, they alter the pH of your vagina, leading to vaginal yeast infection. And that is why some women will keep on complaining that they keep on having reoccurring vaginal yeast infection. Another thing is to avoid perfumed products around that area. You do not need to make the place to have some kind of fragrance. The natural fragrance is enough. It also alters the pH of your vagina, and it can easily lead to reoccurring vaginal yeast infection. So if after the treatment of this yeast infection and it didn't work, there are a number of reasons why it didn't work, and not necessarily because the drug didn't work. It could be because you didn't adhere to the treatment regimen as you should, or it could also be that there is an immediate recurring of vaginal thrush. However, at this point, you can go to the hospital for a proper diagnosis, and another test could be run to determine exactly what the problem is. So if you are under 16 or above 60 years old, then you will need to contact a medical professional before you initiate the treatment for vaginal thrush. Also, if you are pregnant or breastfeeding, you will need to contact the help of a medical professional. So today's special hug goes to Doreen Agbasi, who is watching from Tema, Newtown. Hi Doreen, thank you for engaging, thank you for watching the content. Thank you so much for watching today's video, and I do hope that you got value. If you did, kindly hit the subscribe button and like, share to people so that more people will get the knowledge, and comment, tell me hi Noscarati. Thank you so much for tuning in, and stay tuned for my next video. Bye.